We begin our coverage tonight with an upcoming Senate vote on funding the government that will reveal whether the Republican Party is unified on the issue of defunding Obamacare, and whether Senate Democrats in the White House will continue to defy the will of the majority of Americans who say they oppose Obamacare. The most recent polls say that the public does not want this law in any form at all. The Washington Post finding that 52% of Americans oppose Obamacare. In the latest Fox poll, 60% of Americans say they oppose Obamacare, and the reasons are plentiful. The law, they say, does not work. President Obama promised that if you liked your health care and you liked your doctor, you would be able to keep them both. Even the liberal New York Times today taking issue with the claim. The Times reporting that many insurers are limiting the choices of doctors and hospitals available to consumers under their plans because of the cost of complying with Obamacare. The president promised further that Obamacare would bring down costs for the typical American family by as much as $2,500 a year. And his administration continues to articulate the false claim that Obamacare is also reducing health care costs. But new Forbes studies released today confirm that the average family of four will actually see an increase in annual health care costs of more than $7,000 over the next 8 years. That's an increase of about $800 a year. Not to mention the 41% of small businesses and 12% of all companies who've cut employee hours to comply with the cost of the law, or the 30 million people projected to still be uncovered by the law. One courageous Republican senator has vowed to fight to defund the president's signature health care law. He is Senator Ted Cruz, vocal over the weekend, vocal today on the Senate floor, as Senate Majority Leader Harry Reid began the task of stripping the House legislation that defunds Obamacare of its defunding language. Fox News Chief Congressional Correspondent Mike Emanuel with our report.
Senate Majority Leader Harry Reid kicked off a critical week to avoid a shutdown and continue funding the government. Reid was clearly irritated the House sent over a stopgap spending bill that included defunding the president's health care law.
We will not bow to Tea Party anarchists who refuse to accept the Supreme Court ruled Obamacare to be constitutional. And we will not bow to Tea Party anarchists in the House or in the Senate who ignore the fact that President Obama was overwhelmingly reelected.
Late today, Texas Republican Ted Cruz argued for making it more difficult for Reid to strip the aspect taking money from Obamacare.
Mr. President, that leads to the second unanimous consent request that I put forward. A simple request that every amendment on this continuing resolution be subject to 60 votes.
Senate conservatives who pushed their allies in the House to pass the bill removing Obamacare implementation and enforcement money tried to lower expectations ahead of the confrontation.
I think really we fight it out, and we'll see in the end the Democrats have the Senate and the presidency. It's going to be difficult ultimately to overcome them, but I think we should use the leverage of controlling the House. The Republicans were elected in the House. We were elected to do something. People want us to stand up and fight Obamacare.
Cruz floated a plan B suggesting the House should hold its ground and begin passing smaller resolutions funding one department at a time. Another key Senate conservative says with President Obama in office, defunding the entire law is unlikely, but there are realistic goals.
What I'm hoping we can do, peel off some of the most damaging parts, peel off what we can, delay what we can't, also hold the line on spending. The Democrats want to increase spending above the statutory limits that were set. So those are a few of the things that I think we ought to insist on.
West Virginia Democrat Senator Joe Manchin expressed the frustration that so much of the debate is it must be all or nothing on Obamacare.
Since I've been here, not one of my colleagues have come and said, Joe, here's a better way to do it. Here's how we can fix this part. Let's repeal this, and we'll fix this part of it. Nobody's done that. They just said, okay, vote up or down. Well, let's fix things.
Late today, a spokesman announced Senate Republican leader Mitch McConnell supports the House Republicans' bill and will not vote to block it. McConnell backs it for keeping the government up and running without increasing spending by a penny and for taking money away from Obamacare, so he will not support a filibuster. Lou?
Mike, thank you. Mike Emanuel. The president promised health care costs would go down with the implementation of Obamacare, but that is not the case. We will spend $2.9 trillion this year and $3.1 trillion next year, an increase of 6.1%. The increase makes it difficult, and I should be clear, that's on health care alone, making it difficult for many in the middle class to maintain health coverage for their families. Fox News Chief National Correspondent Jim Engel has just one example in tonight's report from Louisville, Kentucky.
Andy and Amy Mangione and their two boys are just the kind of people who should be helped by Obamacare, but they recently got a nasty surprise.
When I saw the letter when I came home from work, your action required benefit changes and closed Act Now from my insurance carrier.
And it had stunning news. The insurance for the Mangiones and their two boys, which they bought on the individual market, was going to almost triple in 2014 from $333 a month to $965 a month. And the insurance carrier made it clear the increase was in order to be compliant with the new health care law.
This is a high deductible plan where I'm assuming a lot of risk for my health insurance for my family. And nothing has changed. Our boys are healthy, they're young, my wife is healthy, I'm healthy. Nothing in our medical history has changed to warrant a tripling of the premium.
I'm going to have to figure out where we're going to cut, what we're going to do to afford $1,000 a month medical insurance premium.
His insurance company, Humana, declined to comment, but the notice to the Mangiones carries this paragraph saying, quote, if your policy premium increased, you should know this isn't unique to Humana. Premium increases generally will occur industry-wide. Increases aren't based on your individual claims or changes in health status, it continued. Many other factors go into your premium, including ACA compliance, including the addition of the new essential health benefits. ACA, of course, is the abbreviation for the president's new law, the Affordable Care Act, which for the Mangiones will be anything but affordable because the law taxes every insurance policy and requires a list of additional benefits the Mangione family didn't want to pay for.
For people who currently choose to purchase a high-deductible, low-premium policy that's more affordable for them, they're now being required to add all these new benefits to their policy. That's also going to add to the cost of their health insurance premiums.
There's a huge debate over whether Obamacare will raise or lower insurance rates. For this family, that answer is abundantly clear in black and white.